Water is an essential resource for life and good health. Yet, over 1 billion people in the world lack access to safe drinking water supplies. The problem is getting worse as cities and populations grow and the need for water increases in agriculture, industry, and households. As is the case in most developing countries, water scarcity in Pakistan forces people to rely on unsafe sources of drinking water. This has led to diarrheal diseases becoming the #1 killer of children in the country. The Aga Khan Planning and Building Service Pakistan, an agency of the Aga Khan Development Network, initiated a program in 1997 to address this key health issue. The Water and Sanitation Extension Program, the result of several years of combined research and planning by AKDN's institutions, aims to provide integrated water supply and sanitation facilities to rural communities in Pakistan.
पानी तो अवेलेबल है, चैनल वाटर भी है, रिवर वाटर भी है, आपके स्ट्रीम से भी आते हैं, स्नो मेल्ट वाटर भी अवेलेबल है, लेकिन उसकी क्वालिटी जब हमने रिसर्च फेज में भी टेस्ट किया तो वो पीने के काबिल नहीं। 70% विलेजेस में पानी क्वालिटी वाटर की अवेलेबिलिटी नहीं है, मतलब वो पानी तो है लेकिन ये कि उसको सेफ़ नहीं कहा जा सकता पीने के लिए। अगर किसी कम्युनिटी में चैनल वाटर है और वो कंटेमिनेटेड है तो उसके लिए हमने एक फिल्ट्रेशन सिस्टम डेवलप किया है, उसको हम अगर खाली टर्बिड वाटर नहीं है और उसमें खाली साफ़ वाटर है लेकिन कंटेमिनेशन उसमें है तो उसके लिए हम स्लोस एंड फिल्ट्रेशन टेक्निक्स इस्तेमाल करते हैं उसको ट्रीट करने के, उसके बाद उसकी सप्लाई देते हैं।
To ensure long-term sustainability, WASEP's interventions are community-based. An innovative strategy that the program employs is to first encourage the community to invest in low-cost latrines for the household. Once this initial target is achieved by the community's resources, WASEP steps in by constructing village-level water supply schemes and filtration plants.
WASEP was conceived to not just deliver water, but to also deliver health. But in order to bridge this gap between delivery of water and realization of health, several other components were put into it. This includes an integrated program for school and community health and hygiene education. It includes ensuring that the water which is supplied is safe and meets the WHO standards. It also makes sure that the water which is supplied to the house eventually is taken away in a proper drainage form. In order to ensure sustainability of its interventions, WASEP also involves the community in all decision making and implementation processes and trains them to take over the schemes after it is completed. WASEP makes sure that the water supply schemes has an active role of women in all its aspects. One of the key things that we involve the women in is the routing of the water supply scheme, the location of the water tap in the house, the location of the sanitation unit that is put into the house, as well as involving them in the health and hygiene program and educating them on how to properly use and dispose water.
According to a local survey, 40% of rural households in Pakistan do not have any toilets. Even today, in many villages, women can only either relieve themselves in filthy cattle sheds or wait till the sun sets when they can use open fields as toilets. By helping villagers build adequate latrines that do not require a lot of water and are easy to maintain, WASEP has addressed a major quality of life issue for many women in rural communities. This is Zehra, a dedicated mother of 4 who lives in village Khilti of district Khizar. Zehra is very keen that her family always stays healthy and content. Earlier, she would have had to toil at least 2 hours in the snow to look for adequate sources of water for her family. Wasip has changed her life and that of many other women in a comprehensive way by providing clean drinking water at their doorsteps every season of the year.
वासिपो हमें कईगिन इस पर दुरेन की तिसिया तो सफाई हो बरा इस पर चिचेस्तानी बर्तनों क्या किस्म कोरी निगेलिक क्या किस्म बाथरूम इस्तेमाल कोरेलिक बाथरूम क्या किस्म बोगेलिक हे हार क्या उस पर चिचेस्तानी तगार अच्छी ना अजीली बीमार बुनियन ना नंतत बीमार बुनियन तगार अच्छी सेहत दी ठीक बोगी शेरोयन हनिस इस पर आसानी भी तिशनल का शान तंशनी ऊ देहरा इगन तंज जापान निगिसियन टाइम दिस पर बचत होई वो टाइम चोको उठते प्रेगनेंसी हालत है जिस पर ऊख से रोशतम टाइम इस पर ना सनो बोझते कि दूरा ये औरत की सूरज चोतो ना से टाइम नो बोझते पोंछोई दफा ऊगत बोझते नहीं ये एंगी को नो बोझते प्रजु घंटा ऊख से रोशन बाथरूम हो चो दूरते हन से शान तंशे दूरी इस पर ऊख दी इस नो कुशन जमा नो कुशन के टाइम ज़रूरत की चो नलकार इस पर तंगोसियन वो सहूलियत भी दिशर
Wasip's water supply and filtration techniques are also fairly easy to operate and do not require much electricity, making it ideal for replication in rural settings. The Wasip scheme has also been implemented in the terrains of Sindh. In the Keti Bandar town of Tata, people were largely bereft of any hygienic latrine facilities or sewerage systems. AKPBSP specially designed the composite latrine for this particular region. A drainage system has also been constructed, and the dirty water is now drained through covered surface channels into an oxidation pond and disposed of into the sea. Today, all of Wasip's water supply schemes are currently operational and are being run by communities who contribute in cash and also take care of the operation and maintenance of these facilities. Wasip has also helped Pakistan work towards achieving the Global Millennium Development Goals by reducing child mortality, combating malaria and other diseases, promoting gender equality and empowering women, and ensuring environmental sustainability by reducing water wastage, preventing stream contamination, and encouraging composting latrines. Over 165,000 people in 225 villages have benefited from Wasip water supply and latrines. Wasip has reduced the occurrence of diarrhea and other waterborne diseases by over 60%. 70% to 94% of the beneficiaries report that Wasip has increased access to education, disposable income, and has also improved women's health. Over 225 villages have been provided training in construction of water infrastructure. Over 86% of Wasip schemes have met or exceeded World Health Organization standards for potable water quality. Over 5,700 health and hygiene education sessions have been conducted in local households and schools, generally with women and children. Water collection time for women and children has decreased from an average 3 to 4 hours per day to almost zero for the entire year. Wasip was named winner of the 2005 Alcan Prize for Sustainability of $1 million. Wasip also won the Dubai International Award for Best Practices in 2008. Wasip's high-impact interventions have effectively improved the quality of life for many rural communities of Pakistan. One day, every village in Pakistan could benefit from clean drinking water and hygienic sanitation facilities. There is no dispute that from the coasts in the south of Pakistan to the mountains in the north, every inhabitant deserves the right to quench their thirst for clean drinking water.